Hello, and welcome to another episode of Intersections, Policy, Program, and Practice Exchange. My name is Elisa Gwilliam, and today I have the pleasure to be speaking with Andrew O'Grady, Executive Director of Mental Health America Dutchess, and Dr. Larry Force, Professor of Psychology and Director of the Center for Aging and Disability Policy at Mount St. Mary College, and co-founder of NOAR, the National Organization of Adult Addiction and Recovery. So Andrew, why don't you get us started today?
Yeah, so this is great. We're back on here. Have a new guest. Looking forward to talking to her. We here at MHA, and this ties into this Intersections program. Today was the official day of our merger with Mid-Hudson Addiction Recovery Centers. The MARC agency, as it was known for 55 years, is no longer. They dissolved as a 501c3, and all the programming remains the same, but that programming is being run by MHA now. So that ties into, my theme on this whole thing about breaking down silos and having people not go in the wrong door. They have the gumption and the courage to finally reach out and try to find help, and then they're told, it's more about that. Go over there, and I'm not about that. And now our agency provides the full range of addiction and mental health services all under one door. And, I'm hoping it's a model. I'm hoping we can pull some data that will further this goal throughout our region, because I think it's really important that people aren't turned away when they finally get the courage to seek help. So with that, I'm going to turn it over to my friend Dr. Larry Force.
You like the way that sounds, don't you? Dr. Larry Force.
Larry Force.
Andrew and I go back a long time, from the classroom to now the video cast. Long time, years, 30 plus years. So look, first of all, congratulations on navigating that merger. That was like a 2-year process.
More than that.
Two plus year process.
Yeah.
Really, congratulations. I'm a big believer in it's all about connections. So last week, longtime friend Doug Hovey joins us. Doug is the executive director of independent living in Newburgh. As we continue the conversation, he says, you need to meet Linda Ferdico. I said it correctly. I've been practicing that. Linda Ferdico, because Linda is the regional director of peer services at Independent Living. So Linda, on behalf of Alyssa, Andrew, and myself, welcome to the Intersections videocast.
Thank you for inviting me.
You're welcome. So here's the main question. Did you ever think you'd be working in this field? How did you get here? What's a day in the life look like?
That's a big question. Did I ever think I'd be working in the field? Yes. In this capacity, no. I love what you're doing at MHA. I love the idea of breaking down the silos. In my life story, institutions, whether it be jails, prisons, BHUs, inpatient treatment, I was exposed to at a young age with family members and seeing things, and I went through my own recovery journey. So I always knew that I wanted to come back into the field. But after I did my treatment, the way we did that was by becoming CASACs. I never heard of a SERPA, I never heard of a peer. I just knew if you want to go back, you get your CASAC. That's what I did. I ended up for a long time in a women's and children program, and I really enjoyed what I did, but I just really started to get burnt out, and I really missed the deeper connection that I was hoping to get in the beginning. And then I was lucky enough to get introduced to independent living. And in the role that I'm in now, I get to work with people who are incarcerated in the mental health system and in a substance use system. And I finally get to have all three of these things together at one time. And we're able to create and promote programs that will really meet someone where they're at, to take away the stigma, to take away the judgment, and just really get to be honored, really, to be walking with this person on their recovery journey and what that looks like to them. And so for that piece, I'm so grateful, because no, I didn't think that would be something I would be able to do as a profession.
That's great. Alyssa's going to put up two quick pictures, not videos, two quick pictures. Andrew is a strong, strong advocate of tear down the walls. June 16th, year and a half ago, I'm driving down Route 9, boom. I worked in state institutions for years, so this really caught my eye. I turned around on Route 9, I took a picture. It's the main building of Hudson River being torn down. The tagline is mental health at its best, the tearing down of walls. But we have another picture. And the other picture is the blending, the idea of blending together services, not categorizing, not as Andrew talks about, not having different silos. So and Alyssa's going to bring that picture up as well, which is right here. There's a long story to it. The story is that the founder of MHA nationwide asked people to send in their shackles that they used to use. And then he had it all blended together, and it's a bell. And then at all the MHA national associations, the bell was there. They ring the bell. It's a sense of freedom, as you were talking about, a sense of the journey of being able to walk with somebody. Talk to us about what a day looks like, because as you talked about, look, you didn't know about, you heard CASAC, and now the buzzword in the arena is peer. And here you are as the regional director of peer services. Tell us what that means and how that can be of help to people that are, some people will have no connection with recovery that are watching this. Some people will have years of recovery, and some people will have hours or days in trying to figure out how to walk this journey.
So for me, what a peer means is you're someone who has lived experience. So for the mental health peer, they usually consider that direct lived experience. On the substance use side, it can be as an individual impacted by addiction or a family member or loved one impacted by addiction. So there's two different definitions going there. With my role now, I get to live in my truth by being someone who is in long-term recovery and who also has a co-occurring diagnosis. And I get to help create programs that will be tailored to the different needs that we're seeing in the community. So we have programs that are funded by Oasis who have a stronger focus on substance use, but we're really integrated. So even though the grant might have the purpose of trying to reduce overdose death rates, we also need to look at the mental health. We need to look at, is this person connected to services? Do they have housing? Let's start there. Do they have food? What kind of systems are they in? What is the legal status going on? And really take a step back and look at that whole person. So even though I oversee 7 different programs, we really apply the 8 dimensions of wellness and looking at the whole person in each of these 8 programs. So a day in the job could be anything from a provider's meeting to writing a scope of work, like I think Andrew's doing right now too for our SOAR 2 grant going to year 2, working on that. It could be meeting with drug court. It could be helping someone get into treatment. It could be being a shoulder for a family member to lean on. It could be advertising events in the community. We do Narcan trainings. We are really trying to promote harm reduction in general and really trying to do our part to reduce stigma when it comes to that, because that's another key thing to what we do. The stigma has to stop. People are dying for mental health and for substance use.
I love that we're bringing in, now that this, I mean, you're right. People used to go in through the CASAC. They were in recovery and they want to help other people, and that's the way to go. But I love that we can hire peers now, and it's so vital because, I think about trying to reach out to people who have accessed our services or reach out to family members who have accessed services and find out what worked and what didn't work from their perspective. Because as the providers, we can all sit, I like to break down the silos, but the reality is we only see what we see, and we can't really fix things unless we understand, that they're not working. And sometimes the workers that are doing their part, they're doing everything they need to do, but they don't really understand that it's not really working for those that are utilizing the services. So to get perspectives in agencies like yours and ours from people who have gone through it, it just makes us all stronger and better. And so what you bring to the table for your organization is top notch. And I've heard wonderful things about you, by the way.
Thank you. And I couldn't be prouder of the teams that I supervise. I couldn't be prouder of my agency, and I sincerely mean that. there's so much freedom when you're given permission to be yourself. Like I love the part of what I do, the HR piece too, right? Like, so we would help with like interviewing and recruiting for the teams, and you see those gaps on somebody's resume. And it's like, no, really, please let me meet you. Tell me about the gaps on your resume. And you see that wall come down and you meet that real person and they come out and they can be themselves. And then that can keep getting passed down to the participants that we're working with, or just, and you can see that person's life shift too that you're working with. So that's also very special in what we're able to do.
You know, the one thing that has changed across time is the use of technology. You know, the other thing that's changed across time is the response to COVID. So talk a little bit, like we've had guests on, and one of the takeaway messages is, yeah, we've been quarantined, we've been working off, out of our offices, but we're always open. You know, you can always connect with us. So talk to us a little bit about the use of technology in what you do, because that's how many people will be accessing even this video. And also, I'd like to know more about this regional. So regional is part of the state, regional is part of the country.
For us, when we say that, it's the Mid-Hudson region, the 7 counties encompassed in. So especially for onward recovery, that is Oasis Regional Community Outreach Center. So it has guidelines set by Oasis, funded by Oasis, and it's really meant to be that recovery hub. So that's where someone could get that direct connection to a certified recovery peer advocate, whether that be for referrals, working one-on-one. And so we did have a hard time in the beginning because we were so used to being stationed in the community. We wanted to be boots on the ground. We wanted to be by where things were happening so people would have easy access to us. And I was pleasantly surprised by how much our programs took off virtually. And as we all know, the need was there, especially for addiction and mental health in 2020, the need exploded. And even we started to create daily groups. So we had multiple groups a day because the numbers were growing so high, and we were averaging 400 to 500 people a month in a group. We never had that high of numbers when we were in the community because now transportation is not an issue, childcare is not an issue, and we're able to see these friendships, like somebody in Yonkers is becoming friends with somebody in Loch Sheldrick, and to see even more of that networking and fellowship build was very nice. But that's not to take away from the one-on-one component too, which is very important. And we are at a point now where we are going out into the community. We don't have this center opened, but we are meeting folks out in the community, whether that be at a coffee place, if that's outside of their house, at a park, whatever would be the safest for that person and what they're the most comfortable with. Because we did also see those reports coming out in 2020 with the increase in overdoses and all that going on, and just the real need for people to have interaction with other people. So we really try to balance it too. We really have seen the hybrid model work well, and we want to keep components of the hybrid model, but it will never replace the actual physical interaction that we need to have in our field.
Absolutely.
There's definitely benefits though, for sure.
Yeah, there is.
Widening that circle of people that are there for you is a huge one.
But even for us, one of the projects that we're involved in is Peer RX. And with Peer RX, the whole way it gets released is the virtual component, right? Like the nurse being able to go right into a chart and click a button and say, there's an individual in the emergency room who wants to be connected to a peer. And then a text message comes out to the peers who are connected to the hospital. And then we can respond, yes, we're available to meet with someone. And within 10 minutes, that individual in the emergency room can have the instant connection with the peer. That's amazing. That's from technology. So I definitely see the benefits, and I'm very grateful for them.
You know, Doug was talking about the Peer RX. When he started talking about it, it's the first time that I became aware of it. And I loved his description. He was like saying it's like Uber for treatment. And I love that. And the fact is, let's talk about a person is, because I know that some agencies are using our video cast for in-service training. Some individuals are looking at this and they're grounded in long-time recovery. But there are some individuals who might be sitting in one of Andrew's homes or might be sitting at their own home, and they're trying to figure out how to connect. Can you talk a little bit about how a person could connect with you and your network, your network of support and services?
Yeah, we have different points of intake for the program, but they could call me directly if they're watching this and they're not sure about like what program do I fit into or what my next steps be, or even what does recovery mean. They can call me and we could go from there. So my phone number is 845-863-4471, and we can help go through that piece together. I know it can be overwhelming calling agencies, and it could be scary and nerve-wracking, so they could reach out to me. And what was the other piece of your question? I'm sorry.
The other part is, I was just talking about that there are people along the road. Some people are just brand new, trying to figure out, and Andrew and I have talked about this. When we came into the field, there was really only one focus, and that was on abstinence. Now we're talking about multiple doors, harm reduction, multiple doors, moderate. So it's a different type of, I'm a still strong believer. I still strongly believe instead of trying to play with this thing, abstinence seems to be the easier, safer way. And therefore you're not, because sometimes, but again, I can tell by your lips that you may not agree with that.
Sorry,
And
I don't.
Right, and that's okay, but I can only tell you from my lens. I've seen other things work, and again, when I came into the field, that was the thing that was grounded into my paradigm. But it's different now.
I understand where you're coming from. So before coming to independent living, and when I was in the treatment realm, that's what my word would be for it. MAT was very taboo. It was very negative. It was very stigmatized. And then even I have so much guilt now looking back. And at the agency, they really thought they were doing the right thing. They really thought they were doing the best practice for the folks in the program in the house. And I look back on just and how it really truly wasn't. And I think it had to do a lot with lack of information being given to the providers. So now that I have a deeper understanding of harm reduction, MAT, and these different, even fentanyl test strips, right? Like that was something I would have been like, what do you mean? But now like, this is something that could save somebody's life. And I think it's time that we all take a step back and we see there's a human being in front of us who's going through some kind of pain, something's going on. What can we do to keep this person alive? And that really has to be the shift in the conversation. And whether that be—
I just want to ask for purpose of clarity. When I mean abstinence, I'm not talking about the exclusion of MAT. I think MAT
good.
medicated assisted treatment. So this way people know what we're talking about. Because there was a time that, any type of medication was considered to be taboo. I'm not a believer in that.
Okay.
I think that, again, that combination, if you can use a little bit of this and a little bit of that, when I'm talking about abstinence is that there was a whole movement by Audrey Cushline called moderation management. And she was trying to teach people who drank alcoholically how to drink moderately again, and didn't have a great success with that.
Okay, thank you for clarifying that. I do appreciate that. For the multi-pathways of recovery, that is key to the substance use disorder peers. What we go through in our training for the SERPAs, we learn about the multi-pathways to recovery and how recovery is such a unique definition to each person. So maybe someone's goal might be, I wanna smoke a little less this week than I did last week. That's a great goal. Let's do that. Or maybe like, I want to maybe one day want to smoke or use something less. That's a great goal too. So we're going to come in with motivational interview and meet them on that stage of change. And we're going to work with them on that. And then for other people, continuing to use might still be a part of their story. And so we're going to say, how can we help you do this as safely as possible? Maybe it might be a syringe exchange program. Maybe it might be fentanyl test strips. Maybe it might be the never using a loan hotline number. And again, with the goal of we want to do whatever we can to help keep that individual alive as they walk through this journey of recovery. And then full disclosure from me, I became someone who lost someone. So that made me become even more passionate. Sorry about that.
Listen, understood. Understood. All right. So thank you for, look, we could talk, and we've talked about this before we came online. We could talk for days. And if you think this is the only time you're going to see us, you're wrong.
I will gladly come back. Yeah.
I'd like to be back again. Yeah, that would be great.
Absolutely. So, but at this time, we're going to turn it back to Alyssa, and if she could provide you, she's going to provide the summary and also ask for your contact information. But, you know, like Andrew, I heard a lot of good things about you as well, and obviously true. So thank you so much for being
Thank
here.
you. That was very nice.
Okay. Alyssa?
So Linda, if someone wanted to reach out to you or your agency again, do you want to provide that number?
Sure, they could call me or text me, whatever they're the most comfortable with, at 845-863-4471, or they could email me at lferdico, FERDICO, at myindependentliving.org, and we could go from there.
Well, thank you so much for being our guest today.
Thank you. I really appreciate this.
Awesome. We'll definitely have you back. And thank you
Sounds
for
good.
watching today. You've been listening to Intersections Policy, Program, and Practice Exchange. If you want to rewatch this video, share it with friends, or leave a comment, log on to our website, www.intersections-exchange.org. Until next time.